So coronary calcium scores are a kind of an imaging test that is for the general population to really do an assessment of cardiovascular risk. And so we can't see cholesterol on a CAT scan or a chest x-ray, so we use calcium as a surrogate for where cholesterol deposits. So it's a CAT scan. Most patients understand that a CAT scan involves a radiation imaging test. It's fairly quick. It's about 10-15 minutes, if that. Patients do have to lie flat. But the information we get from that allows us to have a discussion with patients regarding your risk for heart disease. And so on top of the basic risks that patients have, their own co-diagnoses such as diabetes, high blood pressure, cholesterol, what their family history is, if they have any symptoms. This is an additional piece of information that allows us to calculate somebody's risk in the next 10 years or so and then dictate treatment. So should somebody be on more intensive cholesterol lowering medication? Should we be thinking about other medications for patients who maybe don't qualify just based on their blood work? So it's a very important test that primary care doctors can order. We as cardiologists order as well. And looking at patients who maybe have some risk factors, who have a family history that is strong for heart disease. And the reason is to then have a risk number, that allows us to talk to patients about medications and next steps. The coronary calcium scores are a very inexpensive test. Actually, at UH, they are free. So they're a free test that patients should talk to their primary care doctor or cardiologist about obtaining. It's not a test that you need to have serial tests done, so usually once in a lifetime is a good score, so you can encapsulate at that time what somebody's risk is. You can imagine calcium doesn't change day to day or week to week, so a coronary calcium score doesn't need to be repeated every year, every couple of years. One time kind of check in so you have a risk assessment, and then modification of your risk factors is a good way to lower your risk for heart disease.